Good morning, my name is Jairo Zambrano Muñoz. My topic is chemotherapy in tuberculous meningitis. Universidad Católica Santiago Guayaquil Nursing School San Vicente del Pau. Datos personal, teacher John Moscoso, Facebook Jairo Pon link @facebook.com, Twitter @Jairo Sukion Hugo 93, YouTube channel. Definition: meningitis is characterized with the presence of abnormal numbers of leukocytes, more than cells after the neonatal period, in the cerebrospinal fluid (CSF), and when Mycobacterium tuberculosis is isolated in it is called tuberculous meningitis. It is a serious infection that compromises the meninges, with a serious devastating effect of the central nervous system. Reason with practically the majority, 18% of the patients are left with neurological sequelae.
This patient has a history of HIV and presented with deteriorating neurological status. Imaging demonstrates multiple enhancing extraaxial dural-based lesions with extensive brain parenchymal vasogenic edema. There is also an intraparenchymal lesion centered in the left basal ganglia. A brain biopsy was ultimately performed, which revealed tuberculosis. Features that may be suggestive of tuberculosis are the combination of meningeal disease in addition to parenchymal lesions. This represents hematogenous dissemination of pulmonary disease and is associated with a significant mortality rate, as well as a long-term morbidity rate cited as reaching 80%, even if successfully treated. Tuberculosis is an important differential diagnostic consideration, particularly in immunocompromised patients or those that are emigrating from endemic areas.
Application in nursing. To apply the nursing care process according to the need of the patient. Apply BISAFELI standards to avoid contagion with droplets. Made a thorough evaluation caudal cephalus. Administer the drugs of the indicated time to avoid resistance. Accompany the patient to the corresponding examination. Is applied in Ecuador. For 2012, the incidence was 2.44%, which 52.4% of the meningitis tuberculosis case 6, according to the 2012 cohort treatment success. In the country, for new cases with positive bacilloscopy was 18%, and another 76% cured and 4% with treatment completed. Likewise, in that year, 11% of cases were reported, with TB, VIH, and B 20 13, the incidence was 1.69%, which 54.78 tuberculous meningitis cases. Pros and cons. Meningitis tuberculosis is a disease that can be diagnosed quickly and receive timely treatment with antituberculosis agents such as rifampicin, isoniazid, pyrazinamide, and streptomycin or ethambutol. The treatment is usually 3 months, divided into 2 schemes. It is important that pharmacological treatment is respected, otherwise it can create resistance and it becomes more difficult the healing process.
Tuberculous meningitis is a serious bacterial infection of the cerebrospinal fluid. Up to one-third of patients die despite treatment. Therapy for tuberculous meningitis is based on data from pulmonary tuberculosis, but the standard treatment may not achieve sufficient drug concentrations in cerebrospinal fluid. The standard treatment consists of pyrazinamide, ethambutol, isoniazid, and rifampin at 10 milligrams per kilogram per day for 3 months, followed by isoniazid and rifampin for 6 months. In this study, investigators asked whether using a higher dose of rifampin and adding levofloxacin could improve outcomes in tuberculous meningitis. At 2 medical centers in Vietnam, 817 patients with tuberculous meningitis were randomized to receive either the standard treatment or intensified treatment. For the first 8 weeks, patients in the intensified treatment group received standard treatment plus levofloxacin, with their dose of rifampin increased to 15 milligrams per kilogram per day. All patients received dexamethasone. 3% of the patients were HIV positive. There was no difference between the 2 groups in 9-month mortality rates. 113 patients died in the intensified treatment group as compared with 114 patients in the standard treatment. And there were no differences based on patients' HIV status. The overall number of adverse events did not differ between treatment groups. Thus, intensified treatment with higher dose rifampin in the standard regimen plus levofloxacin did not improve outcomes in patients with tuberculous meningitis. Full study results are available at nham.org.
The conclusion, meningitis tuberculosis is a serious disease and its prognosis is influenced by several factors, such as age, duration of disease before diagnosis, clinical stage, and time of treatment. Diseases that can be prevented with BCG vaccine can help prevent serious forms of tuberculosis, such as meningitis, in very young children living in areas where this disease is more common.
Is an infectious and contagious disease caused by a bacterium called Mycobacterium tuberculosis. TB represents a truly global threat. Up to one-third of the world population may be infected or has been exposed to tuberculosis. Anyone can be exposed to or get TB. This disease is transmitted or spread from person to person through droplets of saliva or mucus expelled through the sneeze, coughing, shouting, or singing, as it may contain the TB bacteria if the person has the disease in its active stage. If a healthy person breathes in these droplets, the mycobacterium can lodge in the lungs. It can also migrate via the bloodstream and affect other organs, such as the skin, kidneys, spine, meninges, or the urinary system. TB is not spread through contact with personal items, clothing, or through shaking hands. People most susceptible or at greater risk of contracting the disease are people with weakened immune system, patients with HIV/AIDS or diabetes, smokers, the elderly, patients with organ transplantation, and alcohol symptoms of active tuberculosis are poor appetite, weight loss, cough that may be accompanied by bloody sputum, variable fever, night sweat, chest pain, and fatigue. If you or someone you know has any of these symptoms, or if you have been in contact with someone who shows the above-mentioned symptoms, it is important to talk to your doctor or go to your nearest medical facility. TB can be diagnosed with a simple skin test known as the Mantoux reaction, or tuberculin test. A series of tests that may include a chest radiograph and samples of blood and sputum can be used to determine TB infection as well. TB is treatable and curable. Once diagnosed, it can be addressed through a series of specific antibiotics. Talk to your doctor when planning your treatment. It needs to start quickly to increase your chances of overcoming TB. Make sure you understand the instructions to get answers to your questions. Treatment can last several months. It is very important to follow it strictly. Even if you feel better, there is no reason to stop your treatment. You must complete it as indicated by your doctor. Failure to comply with treatment as indicated can cause the mycobacteria to become resistant to antibiotics. This can make TB more aggressive and dangerous, a condition known as drug-resistant tuberculosis. To prevent the spread of infection, maintain good nutrition and drink a lot of fluid to stay well hydrated. Attend regular health checkups with all family members. Avoid staying for a long period of time in a crowded place. Avoid drugs, alcohol, and cigarettes. When you cough or sneeze, cover your mouth and nose with a tissue or your arm. Also, use a face mask when possible. Let's all take these preventative measures to stop the spread of TB.
The finally video is this.